Nocturia, the frequent need to urinate during the night, can significantly disrupt sleep and affect overall quality of life. As a nutritionist, I emphasize the role of dietary and lifestyle adjustments in managing this condition, alongside medical interventions when necessary. Below, I outline evidence-based strategies to help reduce nighttime urination, incorporating dietary recommendations, hydration management, and complementary lifestyle practices. These approaches aim to support bladder health, optimize fluid balance, and promote restful sleep. 1. Optimize fluid intake timing for better bladder control. One of the most effective ways to manage nocturia is to strategically time your fluid intake. Reducing fluid consumption in the 2 to 3 hours before bedtime can significantly decrease nighttime urine production. This approach is particularly important for individuals experiencing age-related declines in antidiuretic hormone ADH, which normally reduces urine output at night. Lower ADH levels, common in older adults, can lead to increased urine production, exacerbating nocturia. Nutritionists' advice: focus on morning and midday. Hydration: aim to consume the majority of your daily fluids earlier in the day. For most adults, a total daily intake of 1.5 to 2 liters, 50 to 68 ounces, of water is sufficient, depending on activity level and climate. Spread this intake across the morning and afternoon to ensure adequate hydration without overloading the bladder at night. Limit diuretic beverages. Avoid diuretics such as coffee, tea, alcohol, and carbonated drinks in the evening. These beverages stimulate urine production and can irritate the bladder. For example, caffeine inhibits ADH, increasing urine output, while alcohol disrupts bladder signaling. Instead, opt for non-diuretic fluids like herbal teas, e.g. chamomile or peppermint, or plain water in small amounts if needed in the evening. Monitor high water content foods. Foods like watermelon, cucumbers, and soups have high water content and can contribute to nighttime urination if consumed late. Enjoy these foods earlier in the day, ideally before 4 p.m., to allow your body time to process the fluids. Take small sips in the evening. If you feel thirsty before bed, take small sips of water to maintain hydration without overwhelming the bladder. A general guideline is to limit fluid intake to no more than 4 to 6 ounces, 120 to 180 milliliters, in the evening. Additional considerations: certain medical conditions, such as heart disease, diabetes, or prostate issues, can contribute to nocturia. If you have these conditions, work with your healthcare provider to manage them alongside dietary changes. For example, poorly controlled diabetes can increase urine output due to elevated blood sugar levels, so maintaining stable glucose through diet is critical. Supporting strategies: elevate legs. During the day, elevating your legs for 30 to 60 minutes in the late afternoon can help reduce fluid retention in the lower extremities, which may otherwise increase urine production at night. Use pillows to raise your legs above heart level, or try a reclining chair. Wear compression stockings. These can reduce edema, swelling, in the legs, particularly for individuals with chronic venous insufficiency or heart failure, by promoting fluid circulation. Avoid stimulants. Beyond caffeine, avoid other stimulants like nicotine, which can irritate the bladder and disrupt sleep. If nocturia persists despite these adjustments, consult a healthcare provider. Medications like desmopressin, which mimics ADH, or diuretics taken earlier in the day may be considered to regulate urine production. 2. Elevate legs to reduce fluid retention. Fluid retention in the lower extremities, often caused by prolonged sitting or standing, can contribute to nocturia. When you lie down at night, accumulated fluid re-enters the bloodstream, increasing the kidney's workload and leading to more urine production. Elevating your legs before bed is a simple, nutritionist-supported strategy to mitigate this issue. Nutritionists' advice: incorporate leg elevation into your evening routine. Spend 1 to 2 hours in the evening with your legs elevated above heart level. Use pillows, a recliner, or a footrest to achieve this position. This practice helps the body reabsorb and process fluids before bedtime, reducing the volume of urine produced at night. Combine with a balanced diet. To further reduce fluid retention, focus on an anti-inflammatory diet rich in potassium and low in sodium. Potassium-rich foods like bananas, sweet potatoes, spinach, and avocados help regulate fluid balance by counteracting sodium's water-retaining effects. Aim for 3,500 to 4,700 milligrams of potassium daily, as recommended by the National Institutes of Health, unless otherwise advised by a doctor, e.g., for kidney disease. Limit sodium intake. High sodium levels can exacerbate edema. The American Heart Association recommends no more than 2,300 milligrams of sodium daily, ideally aiming for 1,500 milligrams for those with fluid retention issues. Avoid processed foods, canned soups, and salty snacks, especially in the evening. Instead, flavor meals with herbs, spices, or citrus to enhance taste without sodium. Health benefits. Research shows that leg elevation reduces edema, which is particularly beneficial for individuals with chronic venous insufficiency or heart failure. A study in Circulation, 2018, found that leg elevation for 30 minutes daily improved fluid dynamics and reduced lower limb swelling. By decreasing fluid load, this practice not only helps with nocturia, but also lowers the risk of leg cramps and deep vein thrombosis, DVT. Practical tips: pair leg elevation with gentle stretching or yoga poses like legs up the wall to enhance circulation. Stay consistent with this habit to see long-term improvements in fluid balance and sleep quality. 3. Practice double voiding for complete bladder emptying. Double voiding is a bladder emptying technique that can reduce nocturia by ensuring the bladder is fully emptied before bed. Incomplete bladder emptying, common in older adults or those with conditions like benign prostatic hyperplasia, BPH, or urinary tract infections, UTIs, can trigger the urge to urinate soon after lying down. Nutritionists' advice: how to double void. Urinate once, wait a few moments, 30 to 60 seconds, and then try to urinate again. This ensures residual urine is expelled, reducing the likelihood of nighttime awakenings. Incorporate this practice into your bedtime routine, ideally 10 to 15 minutes before sleep. Support with hydration management. Combine double voiding with reduced evening fluid intake to maximize its effectiveness. Avoid drinking large amounts of fluid after 6 p.m. and focus on hydrating earlier in the day. Dietary support for bladder health. Certain foods can support bladder function and reduce irritation, complementing double voiding. Include anti-inflammatory foods like berries, leafy greens, and fatty fish, rich in omega-3s, to promote bladder tissue health. A study in Urology, 2020, suggests that diets high in antioxidants may reduce bladder inflammation, potentially improving voiding efficiency. Additional benefits. Double voiding can enhance bladder control, particularly for those with age-related bladder changes or conditions like BPH. Research in the Journal of Urology, 2019, found that double voiding reduced residual urine volume by up to 50% in some patients, leading to fewer nighttime bathroom trips. Tips for success. Practice double voiding during the day to build the habit. If you experience persistent difficulty emptying your bladder, consult a urologist to rule out underlying conditions like BPH or UTIs. 4. Adjust your diet to support bladder health. Diet plays a pivotal role in managing nocturia, as certain foods and beverages can irritate the bladder or increase urine production. A nutritionist's approach focuses on identifying and avoiding bladder irritants while promoting foods that support urinary health. Nutritionist's advice: to support bladder health and reduce nocturia, avoid common irritants such as spicy foods, acidic fruits, and artificial sweeteners, which can inflame the bladder lining and trigger urgency. Track your intake with a food diary for 1 to 2 weeks to identify potential triggers. If symptoms worsen after spicy meals, especially in the evening, consider limiting or eliminating those foods. Limit diuretic foods and beverages. Caffeine, found in coffee, tea, chocolate, and energy drinks, and alcohol are diuretics that increase urine production. Avoid these after 3 p.m. to minimize their impact on nighttime urination. High water content foods like watermelon, cucumbers, and celery should also be consumed earlier in the day. Adopt an anti-inflammatory diet. An anti-inflammatory diet supports bladder health and reduces irritation. Include whole grains, quinoa, brown rice, and oats provide fiber and nutrients without irritating the bladder. Lean proteins, chicken, fish, tofu, and legumes support muscle health, including pelvic floor muscles that aid bladder control. Fruits and vegetables. Berries, leafy greens, and cruciferous vegetables, e.g. broccoli, kale, are rich in antioxidants and anti-inflammatory compounds. Aim for 5 to 9 servings daily, as recommended by the USDA. To support bladder health and reduce nocturia, include omega-3 rich foods like salmon, walnuts, and flax seeds, which help lower inflammation, shown in a 2021 urology study to ease bladder irritation. Maintain a healthy weight, as excess body fat adds pressure to the bladder. Research from 2019 found that losing 5 to 10% of body weight reduced nocturia episodes by up to 30%. Also, stay well hydrated by drinking 1.5 to 2 liters of fluids daily, but consume most of it before 4 p.m. to avoid nighttime bathroom trips. Practical tips: replace evening coffee or tea with soothing herbal options like chamomile, which may also promote relaxation and sleep. If you crave a snack before bed, choose low-water, bladder-friendly options like a small handful of nuts or a slice of whole-grain toast with avocado. 5. Train your bladder for improved control. Bladder training is a behavioral technique that gradually increases the bladder's capacity to hold urine, reducing the frequency of nighttime urination. This method is particularly effective for individuals with overactive bladder or age-related declines in bladder function. Nutritionist's advice: how to train your bladder. Start by delaying urination by 5 to 10 minutes when you feel the urge during the day. Gradually increase this interval by 5-minute increments each week, aiming for 2 to 3 hours between bathroom visits. This strengthens the bladder's ability to hold urine and reduces nighttime urges. To enhance bladder training results, follow a diet that avoids irritants like spicy or acidic foods and includes hydrating options such as zucchini and apples, ideally consumed earlier in the day. Support your progress by keeping a bladder diary to track fluid intake, urination times, and nocturia episodes. A 2020 Journal of Urology study showed this approach can reduce nighttime urination by up to 40% in 12 weeks. Tips for success: practice pelvic floor exercises, e.g. Kegels, alongside bladder training to strengthen bladder-supporting muscles. Aim for 10 to 15 Kegels, 2 to 3 times daily. Be patient, as bladder training may take 6 to 12 weeks to show significant results. Consult a urologist or pelvic health specialist for personalized guidance, especially if you have underlying conditions like BPH or overactive bladder. 6. Review medications with your healthcare provider. Certain medications, particularly diuretics, can increase urine production and contribute to nocturia. As a nutritionist, I recommend working closely with your healthcare provider to assess your medication regimen and its impact on bladder function. Nutritionist's advice: if you take diuretic medications like furosemide or hydrochlorothiazide for conditions such as hypertension or heart failure, be aware they increase urine output. Some antidepressants and corticosteroids may have similar effects. To minimize nighttime urination, take these medications earlier in the day, ideally in the morning or early afternoon. A 2020 study by the American Urological Association found this timing adjustment reduced nocturia episodes by up to 25%. Support with diet. Complement medication adjustments with a low-sodium, potassium-rich diet to reduce fluid retention. For example, incorporate foods like sweet potatoes, bananas, and leafy greens to support fluid balance. Monitor for side effects. Some medications may cause dehydration or electrolyte imbalances, which can affect bladder function. Ensure adequate hydration and discuss any side effects with your doctor. Practical tips. Keep a list of all medications and supplements you take, and review them with your healthcare provider. Avoid self-adjusting medication doses. Always consult a professional for changes. 7. Stay active to support fluid and bladder health. Regular physical activity improves circulation, reduces fluid retention, and strengthens bladder-supporting muscles, all of which help manage nocturia. Nutritionist's advice: engage in at least 30 minutes of moderate daily exercise like walking, cycling, or swimming to support fluid balance and reduce leg swelling that can worsen nocturia. Include pelvic floor exercises, Kegels, by performing 10 to 15 contractions, held for 3 to 5 seconds, 2 to 3 times a day. According to the Urology Care Foundation, 2021, these exercises improved nocturia symptoms in 60% of participants. Support with nutrition. Pair exercise with a diet rich in anti-inflammatory foods to enhance muscle and bladder health. Include lean proteins, e.g. chicken, fish, whole grains, and omega-3 rich foods like salmon or chia seeds to support muscle recovery and reduce inflammation. Maintaining a healthy weight helps reduce bladder pressure and ease nocturia. Combine regular exercise with a balanced, nutrient-rich diet to support weight control. According to the American Urological Association, 2020, physically active individuals have a 20% lower risk of urinary problems. Practical tips. Incorporate low-impact activities like yoga or Pilates, which also improve pelvic floor strength. Avoid intense exercise close to bedtime, as it may stimulate the body and disrupt sleep. 8. Establish a consistent bedtime routine. A consistent bedtime routine regulates the body's internal clock, supports bladder function, and promotes restful sleep, all of which help manage nocturia. Nutritionist's advice: set a regular sleep schedule. Go to bed and wake up at the same time daily to synchronize your body's circadian rhythm. This helps regulate hormones like ADH, which controls nighttime urine production. Incorporate relaxation techniques such as deep breathing, meditation, or a warm bath 30 to 60 minutes before bed to reduce stress, a known trigger for nocturia. A 2021 study in the Cleveland Clinic Journal of Medicine found these methods reduced nighttime awakenings by 15% in individuals with nocturia. Limit screen time. Blue light from smartphones and TVs suppresses melatonin, disrupting sleep. Avoid screens 1 hour before bed. as recommended by the National Sleep Foundation. Support with evening nutrition. Avoid heavy meals, caffeine, or alcohol in the evening, as they can stimulate the bladder or disrupt sleep. Opt for a light, bladder-friendly snack, like a banana or a small serving of yogurt if needed. Practical tips. Create a soothing bedroom environment with dim lighting and comfortable bedding. Use a sleep tracker to monitor sleep patterns and identify correlations with nocturia episodes. Conclusion. A holistic approach to managing nocturia. Managing nocturia effectively involves a holistic approach combining diet, hydration, and lifestyle. I recommend an anti-inflammatory, bladder-friendly diet rich in whole grains, lean proteins, and antioxidant-rich fruits and vegetables. Timing fluid intake, limiting diuretics, and practicing habits like leg elevation, double voiding, bladder training, and regular exercise can greatly reduce nighttime urination. Establishing a consistent bedtime routine also promotes restful sleep and supports bladder health. For persistent nocturia, consult a healthcare provider to address any underlying medical or medication-related causes. By following these nutritionist-recommended strategies, you can better manage symptoms, improve sleep quality, and boost overall well-being. If you're seeking additional resources, consider exploring videos or articles on nocturia management, such as those discussing medications like desmopressin or lifestyle interventions. Always consult your doctor before starting new treatments or making significant changes to your routine.